thinking, but I didn't know I had to hit mic.
Oh, yeah.
All right.
Good?
We're ready to go.
Okay. All right. We'll go get on our screener line.
Bye.
Bye.
Is she going to stay in there? You guys stay? I had to have somebody in here if I need to wave to somebody that I need something. Okay, good, thanks. Well, thanks so much for taking time today to participate in this telephone town hall meeting. I'm delighted that you take time to, from your busy day to share some of your thoughts with me, some of your ideas, and some of the concerns you have. It's Monday, the 27th of October, and it's noon, and I'm in Casper today. As you know, I get home every weekend, travel around the state, and visit with people, see what they have to say, what's on people's minds. But no matter how much you travel around the state, there is nothing to me as productive as this telephone town hall meeting, because you get to hear from people from all corners of the state. And all you need to do if you want to ask a question is push the zero key on your phone, and then I'll try to answer your question. It's interesting times because the elections are coming up a week from tomorrow. And we'll know a lot more then how things turn out with elections all across the country and in our communities. Today in Casper, we had a good meeting with a number of the state senators, state legislators at Meals on Wheels. It's a remarkable organization delivering meals to all people around Natrona County, to our seniors. And they have over 400 volunteers who help out. On any given day, 45 people drive meals around Natrona County. And you take a look at it, it's not just here in Casper, it's all around the state. You have, through the senior centers, meals being delivered all around Wyoming. And in each community, there are volunteers. We had a little discussion just about the benefits to volunteerism. There's actually an interesting medical article that was printed called "The Immunity of Samaritans." And it talks about good Samaritans, people who help out, and in terms of their overall health, it's better. Blood pressure, stress, anxiety, heart rate. For people who volunteer, it tends to help them as well as help the people who they are intending to help, the people they deliver the meals to. But that's kind of the beauty of Wyoming, people always wanting to pitch in, always wanting to help, always wanting to lend a helping hand. And Bobby and I see that no matter where we go, all around the state of Wyoming. Yesterday at church, we had a chance to offer a prayer and a remembrance of Al Wiederspan. Al is the husband of our Congresswoman Cynthia Lummis. He died unexpectedly in his sleep. He was only 65, and you may have seen that in the news. But I think all of Wyoming is mourning the loss of our good friend Al Wiederspan, and for Cynthia and for their daughter Annalise, it's a very, very challenging time, so unexpected that. So they're undergoing significant stress right now. We'll be at services for Al in Cheyenne, and those are Thursday morning at 11 o'clock. Anyway, please keep the entire family in your thoughts and in your prayers. But if you'd like to ask a question, please do. All you need to do is push 0 on your phone, and I think we have a call coming in now. I happen to be in Casper, and she must have been the first to hit 0 on her phone. But if you have a question, please do hit 0 on your phone. And we have Carla on the phone from Casper. Hey, Carla, John Barrasso. Thanks for being part of the town hall meeting.
Thank you for having me. I was just curious about this Ebola, We don't know how many people that they haven't got with the people coming over on the planes and everything, and I was just wondering how safe is it really to travel through the United States?
Yeah, thanks, Carla. No, I appreciate that. There's been a lot of discussion because, the president a couple of weeks ago said, well, it's not going to come to the United States, but in fact it has.
Yes, and I feel like they're covering up a lot.
Yeah, and today it looks like there's about a 5-year-old child who has come over to the United States who is now, they think, diagnosed with Ebola. The doctor who came back into New York City, they listed his condition as serious today. So there are concerns. And I think the first case that went to that hospital in Dallas, they didn't seem to be fully alert to the potential of that. But I think hospitals are more on the alert, but there's still a lot of concern. And one of the questions is, should there be a travel ban? Should the government restrict travel from West Africa back to the United States? Should people who are healthcare workers who are over there volunteering and helping, should they have to go into a quarantine period of time before they're able to go and meet with others? It sounds like that one who came back into New York, who now is in the hospital in serious condition. I mean, he went out to a restaurant, went bowling.
Exactly.
Yes. And those are the concerns that I think all of us have. As a doctor, I have concerns for several components of this. And one is, I think that if somebody wants to volunteer and has medical background and they need people helping over there, this isn't something we spent time working on in medical school, or they don't work on that in nursing school. But I think that somebody who's going to go over and work really needs an intensive training program before they go. So that, because if you see the number of healthcare professionals who are affected, who have been hit with the disease when they were there helping, I'm not sure we have all the answers yet. And that's why I think they need additional help and training before they go over. And then when they go, they should stay there an adequate period of time to make a difference. And when they come back, we want to make sure that their families are safe, other ones that are interacting with them safe, and that may involve some period of time before they're able to actually, interact with their family, or should stop before they are able to really come back and fully integrate at home. And that maybe ought to just be part of the commitment to full training before you go, a commitment to a certain amount of time when you're there, and a commitment to make sure that you are disease-free before you come back into the United States.
Exactly, because like you said, when he went to the bowling alley and stuff, we don't know how many people he had in contact there. And it doesn't seem to me it seems like it's more airborne than anything. Is it warfare? That's what I'm wondering. Is it chemical warfare?
Well, you hear concerns about that with our southern border and with people, get infected and come to the United States. So there are concerns about that. I think that what we know mostly is that it to be the case that it's fluid-borne, blood, and then also other bodily fluids, because people are having significant problems when they are at the height of their sickness. And what is it, 40, 50%, in some places higher percentage of that don't survive. So with treatment, so there are just a lot of still unknown questions. I think it was just common sense to take additional precautions that I don't think we have done the right full job right now. But right now, there's a way on these telephone town hall meetings, Carl, that we can ask questions. And one of the questions is, should the government be restricting travel from West Africa? And if you think the U.S. government should, then push number 1. If you think no, the government should not restrict travel, then hit 2 on your phone. If you're not sure, just hit 3. So, Carla, thanks so much. You've gotten a lot of discussion going here. We have a lot of other calls coming in, but thanks, Carla, for being part of today's telephone town hall meeting. We have another question about that, specific question about Ebola, and I think it's from Dave in Glen Rock. Hey, Dave, John Barrasso, thanks for being part of the town hall meeting.
Thank you, and thank you for having these meetings.
I appreciate you being part of it. It's just, people enjoy them when I talk to them and travel the state, because you get to hear from people from all around the state, and that's why the beauty of it is.
That's wonderful. Yep, that's the way it should be. I had kind of a two-question thing, and I just joined now, so I'm probably going to be sounding like a broken record, but why has not this Ebola crisis finally awakened Congress to put up borders and more restrictions around us instead of letting everybody in the world with everything from Ebola to tooth decay in? I mean, this is ridiculous. We keep on spending our money taking care of the world. We're way out of money a long time ago. They just keep printing more.
We were just with the last question, Carla, we were talking about the same question, Dave, about Ebola, and there's a way on the phone that people can click a number if they think the government should restrict travel from West Africa. Hit number 1, and if you think it's okay, government shouldn't.
Well, I think it should not just be from West Africa, but I mean the border to the south of us and anywhere else we need it. Yeah,
with the specifics with Ebola that we're talking about, specifics of in terms of when Congress does an act. This has been one of my big concerns about Congress isn't there. The president doesn't want us there. In terms of whether it's ISIS, whether it's Ebola, Harry Reid, who's the majority leader of the Senate, we've only had, I think, 8 days since August 1st where we've actually been there voting in D.C.
Well, the thing that gets me, too, is that he has his little presidential edicts that you guys read about Monday morning in the paper just like we do. He had no chance to vote on it.
Well, that's exactly the case, and the president seems to, he has not worked with Congress, and he seems to be happy with his executive orders, which, I oppose across the board. But that's the way that this president has been running things, and this is just one more example, in my opinion, Dave, of what we're dealing with here.
Yeah, he thinks he's a king.
It's and I'm wondering why after the election what he's going to do then. If the American people decide, and I've been working to try to help candidates around the country who think the way people in Wyoming think, and if the president finds out that on election day that Harry Reid's no longer the majority leader, is the president then going to say, hey, the American people have spoken, we need to quit these regulations that are hurting coal, that are making energy costs go up?
No, he won't change anything as long as he can get away with what he's doing. He doesn't care who's under him, who's hurt by him, or anything.
Well, that's why I've been working.
We have a predator with my name on it circling right now.
Hey, Dave, thanks so much for being part of the town hall meeting today. Appreciate your thoughts.
I had one other question.
Yeah, go ahead.
I've been on medications for back pain. I had back surgery almost a year ago, and with age, brains and backs don't get better. And it's getting harder and harder because of regulations for me to get the same medication that I've been on for a long time, pain medication and the like. And is this going to continue or what? I mean, they've just put so many restrictions on it that there's times that I almost have to go without. And, a jaunt from Glen Rock to Casper isn't a big deal, but if I have to go there 3 times a week because of different medications running out at a certain time because you can't buy ahead, what can we do?
And I think this, Dave, is one of the big problems with the health care law. This guy, Ezekiel Emanuel, who the president is the architect of the health care law, he said between now and about 2020, he's thinking 1,000 hospitals across the country, because of the law, are going to close.
Mm-hmm. Well, I hope he needs one.
Well, it's the screwiest thing. This guy, we're talking rural America, which he doesn't understand, and that's my concern. Is in our communities, I think it's going to. My worry is that for the whole Rocky Mountain West, it's going to get harder for all of rural America, which the president
will probably be a punishment
for
not being on the left coast or the right left coast.
Yep. So that's where we are. Anyway, hey, Dave, thanks so much for being part of the town hall meeting. Appreciate it. Thank you.
Thank you.
You're sure welcome. work our way around the state. We've been hearing from people all around the state. Let's see, we haven't heard from anyone in Cheyenne yet today, and I think Donna is on the phone now in Cheyenne. Hi, Donna. John Barrasso. Thanks for being part of the telephone town hall meeting.
Well, thank you for doing this. I appreciate it. I'm just wondering about why we can't, in Wyoming, try to get a voter ID. It's not that I think our state probably needs it less than any other state, but I saw where the Supreme Court had just okayed voter ID in Texas, and I just think it'd be nice to be, on the list that we have applied and perhaps can get permission to get the voter ID. Just as a support system, because I just think it's something that we were just in a third world country not long ago, and they've got voter ID. Anyway, I'd like your response and see what you say.
Yeah, well, thanks, Donna. I like the idea of voter ID. You need ID to get on a plane. You need an ID to do just about anything, cash a check, you name it. And I think you ought to have ID to vote. So I support it. The Wyoming legislature, you may want to talk to some of the candidates who are running to see if they want to introduce a bill to that effect in the Wyoming legislature and what the requirements are going to be. We do know the federal government continues to make it, I think, easier and easier for there to be voter fraud, and I have great concerns about that, but I sure appreciate your thoughts and concerns, and especially as we're looking at election time and with this thing called early voting where, you can pull people in off the streets and get them to vote. I think people ought to try to vote early if they can, but you want to make sure there's no fraud associated with it, and when it's a longer period of time, I think there's a greater chance of fraud to occur. So that's
Let me ask one real quick. The
Sure.
Supreme Court, if they okayed voter ID in one state, why would that not be universal and we'd often have to go through this process of, waiting to get okayed for it?
Yeah, I'm not a lawyer. I'm not exactly sure of that. I think it has to do with what kind of ID they need, how easy it is for other people to get ID, and those sorts of things. And they tend to lean against too much identification. I think that's where they are on this.
Okay. Well, thank you, sir, and keep up the good work.
Thank you so much
for
thank
you.
Part of the town hall
Bye.
meeting. Bye. Next, let's keep working our way around the state, and I think I'm going to head up to Campbell County now, and Tom is on the phone. Hey, Tom, John Barrasso, thanks for being part of the town hall meeting.
Yes, Senator, thank you. I was just curious as to why the United States government hasn't kind of restricted flights from Liberia and Nigeria.
The real reason to that is there are no direct flights right now between Liberia and Nigeria to the United States. I mean, you can't get on a plane in one of those places and come here. So what happens is folks wanting to travel from those countries, in West Africa to the United States, they fly first to, say, Germany or London or Paris, whatever, usually in Europe, and make a connecting flight to the United States. And that's the issue of how is it that, so it's a little more complicated than just the direct flight because you don't know who's been on those other planes and where they're coming in from. So everybody, they're now doing these testing of, people for fever, for flu-type symptoms, who are landing from in a number of different airports, landing in the United States. That's the concern. But I have concerns in terms of folks who have been in those parts of the world, who are coming here and then not being, quarantined or at least observed for a certain period of time.
Right. Well, I certainly do appreciate your answer because it's really helped me. I did not understand.
Thanks. Appreciate it. Thanks for being part of the town hall meeting. We're working our way around the state, and we haven't heard from anybody yet in Carbon County. And we have Encampment on the line, and Shorty's on the line. Hey, John Barrasso, thanks for being part of the town hall meeting.
Hi, John. This is Shorty. I'd like to know where we're at on this Clean Water Act ruling that the EPA has wasted on us. I think we're in more trouble or more danger of losing our rights from our federal government than we are from Ebola. I don't.
Well, you're absolutely right about what the EPA is doing with their rules and regulations about water, and the law is pretty clear, and the EPA is reinterpreting the law in ways that I think is inaccurate and unfair, but is not a surprise when you take a look at what this Obama administration has done. Right now, the law is that water that the federal government has control over is what they call navigable water. And the EPA is saying, well, no, all water is under control. So that, is a prairie pothole, some area, if the snow melts and it leaves some water there, in a ditch, and then they want regulations over all of those things. So it's devastating to farmers and ranchers and very hurtful to rural America. So those are the fights that we're in against this administration and against the president and his, what I believe is significant overreach. The EPA has gone way beyond the original intent of so many different pieces of the law that were never intended to be used the way that the EPA is now using them to hurt our use of our lands and our waters, and it's just overly protective in ways that are hurting our economy directly. And it's interesting, it's not just farmers and ranchers. I had a chance to talk with the golfer Jack Nicklaus, who is retired from golfing, but he still designs golf courses. And for any of the golfers on the call, there are water hazards on golf courses, and they're getting impacted by the EPA in terms of trying to design golf courses, and sometimes they build homes around the courses. So businesses all around the country are being impacted by this incredible overreach by the EPA, and we're trying to shut them down and trying to get like-minded people from both sides of the aisle, Republicans and Democrats alike, who can see the devastation that this regulation is causing for farmers, ranchers, and businesses around the country, and that's where we are right now with it. So thanks for being part of the call, Shorty.
Thank you.
You're sure welcome. We're going to work our way around the. Let's see. We got a lot of calls about. Looks like a lot about healthcare and Ebola, and Pat is on the phone from Cheyenne. Hey, Pat, John Barrasso, thanks for being part of the town hall.
Hi, John. Nice to hear from you again, and thank you for allowing me to be on these town hall meetings. I really like listening to what you and Senator Enzi have to say. It shows you guys really care about us. Now, my question is about the person that the president has nominated as a Surgeon General.
Yes.
Dr. Murphy. And Dr. Murphy is claiming that the NRA is responsible for the Ebola crisis. We know that he's totally anti-gun.
Yes.
And it doesn't seem as though he is knowledgeable at all about anything about this disease. But he's trying to help get rid of guns.
You got it right. The president nominated him about a year ago, and they have not yet held a vote in the United States Senate on him. I'm opposed to his nomination. I've spoken out against it for a couple of reasons. The thing that's interesting, they changed the rules of the Senate so they'd only need 51 votes to get somebody confirmed, and he is so extreme that they can't even get Democrats to vote for him. So it's not just, he said, well, the Republicans are stopping me. It is bipartisan opposition because the president has nominated someone for this position who is way off of the mainstream and really isn't qualified for the job of Surgeon General. When we think of Surgeon General of the United States, I think of somebody like C. Everett Koop, kind of white-haired, somebody with a long history of public health and knowledgeable about health issues. This nominee is in his mid-30s, and he's more of a medical entrepreneur than actually a practicing physician with a background in public health and caring for patients. And he's come to the attention of the president for a couple of reasons. One is he was a big fundraiser, raised a lot of money for Barack Obama running for president. He actually started a group called of, I think, Physicians for Obama. So that's how he became known to the president. And then you're 100% right. He has put out newsletters and letters to all members of Congress chastising those of us who support our Second Amendment rights. So he thinks that that is one of the big health problems in America, is us using our constitutional rights. Now, you know, when I talk to folks around Wyoming about our Second Amendment rights, our rights to own and bear arms, there are Republicans and Democrats alike who know what the Second Amendment stands for. And that's why the president can't get this person confirmed, because Democrats don't want to support him either. And I can run a list of a number of Democrats who have spoken against this nominee and say, look, we need a Surgeon General. The United States at this time, with Ebola happening, why do we not have a Surgeon General? And the reason is because the president has nominated somebody who is so unqualified that Democrats don't want to vote for him.
Wow. Yeah, I had gotten my NRA newsletter, and they said that his main thing is he uses his position as a medical practitioner to get political gain, and that's exactly what I'm seeing, because his view on guns is the same as Bloomberg and Obama.
Yeah, and that's why the president nominated him, not because he is a knowledgeable individual who should actually be the Surgeon General.
Yeah, not expert, I don't think.
His doctor, yeah.
You know, he's probably, just barely gotten out of his residency.
Yeah.
Yes. And somebody like you would be a lot better qualified, as far as I'm concerned.
Oh, thanks, Pat. Appreciate you. Well, thank you.
You do so much for us. Why couldn't you could do a lot for the country?
Well, I'm very blessed.
That's a huge vote of confidence. Yeah, I know.
Thank you. Appreciate it. Hey, thanks, Pat. Thanks for being part of the town hall meeting. Working our way around the state, and let's head up to Fremont County. We haven't heard from anybody in Fremont County, and I think Corey is on the phone in Fremont County. I think are you in Lander, Corey?
Yes.
Oh, great. Hey, thanks for being part of the town hall meeting.
You bet. I was just wondering, has there been any progress in getting rid of the healthcare initiative at all?
Very little, other than the fact that the elections are in 8 days, and I have specifically been traveling, trying to encourage people to vote for candidates who, like you and I, are focused on eliminating this health care law, which is not what the president promised the American people, and it's not what the American people wanted in health care reform. Realistically, the president's still going to be there for another 2 years. I mean, we need to reverse the damage that's being done and the pain that it's causing for people who are paying higher premiums, who've lost their doctor around the country, who can't continue. And just a little earlier, we were talking about the fact that the architect of the health care law, his name is Zeke Emanuel. He's Rahm Emanuel's brother. He said he's expecting 1,000 hospitals around the country to close as a result of the health care law. Well, that's rural America. It doesn't matter which party you're from, but if rural America is going to get hurt by this health care law, and that's why I have such great concerns about it. And that's the fight. Now there are bills that passed the House, bipartisan bills. Republicans and Democrats alike voted for them to dismantle parts of the health care law, to try to make parts of it optional. I have legislation called the State Health Care Choice Act, so that states could opt out of either the entire law or parts of the law, and let states and individuals make those choices. But Barack Obama and then Harry Reid, the majority leader in the Senate, have blocked those votes from even occurring in the Senate, which is why I'm working so hard to help the Republicans take back the Senate.
Well, I have 2 kids in their 20s, and they still don't have health insurance because they tell me it's cheaper for them to take the hit on their income tax than it is to get the insurance.
Well, that's not what the president promised, which is why there's so many people that think the president hasn't told them the truth about being able to keep their insurance if they liked it and what it was going to cost them. it was only a year ago. It was last October when those exchanges opened, and he said it was going to be easier to use than Amazon and cheaper than your cell phone, and that's not the case. It's just not the case.
Well, thank you.
You're sure welcome. Thanks for being part of the town hall meeting today, Corey. I appreciate your call. The questions are coming in from all around the state, and let's head all the way up to Powell, and I think Kay is on the phone in Powell. Hey, Kay, John Barrasso, thanks for being part of the town hall meeting. Kay, are you there? Kay?
Yes, I am. Thank you for taking my call.
Yes, thank you. Go ahead.
I was wondering why all of these things that are happening in Washington, criminal acts and stuff, and they seem to get up and say, the politicians get up and say, I take full responsibility, and that's the end of it. Why can't some of them be prosecuted more?
Well, you saw Hillary Clinton do that about Benghazi. She said, I take full responsibility.
Oh, yes. And that
yeah.
Congressman, I think he was a Congressman, Weiner.
Yep.
My goodness, if that would have been in the real life, think what would have happened to somebody.
Yes. Yeah. You can't believe it. And look at the VA hospital system. All of those people, and they were allowed to take to retire or resign, and then they get the full benefits of retirement. I mean, that's kind of the way this
administration
allows it.
Yeah. People in the real world don't get all these bonuses for doing a good job, let alone some of the stuff that they do.
Yeah, well, you're 100% right. And look at the Secret Service.
Oh, yeah, and look at the IRS.
Yep. Yeah, I mean, it's kind of across the board right now. And people, I talk to people around Wyoming, and we were at homecoming a week ago at the university, and, just kind of at Tailgate Park visiting with hundreds and hundreds of folks. I mean, there's a lot of anxiety about the direction the country's headed, and a lot of anger with what's happening in Washington, just to all of the points that you've made.
Yeah, and also there's getting to be a lot of upset people when there's talk of this refugee camp maybe coming to Wyoming.
Yeah.
Why do we need them?
Yeah. And well, you're 100% right about what we're talking about and what the issues are, and people are very concerned just about what is
bringing in diseases and being on our welfare system. They'll break the state. I can't understand why they even want to bring these people in from Somalia.
There's a lot of concerns now, which is part of the anger and part of the anxiety that I'm hearing about as I travel around the state, and that's the benefit of this town hall meeting, so folks can, present their opinions. So I appreciate it, Kay. Thanks for being part of the town hall meeting. And hey, Powell, the one of the schools up there is a Blue Ribbon School, getting a big award for such a good job. I think it was one of the great schools in Powell. So I don't know if you're aware about that, but it's a terrific.
Powell has really good schools.
Thanks so much for being part of the town hall meeting.
Thank you.
You're sure welcome. Bye. We're working our way around the state of Wyoming, and let's see, we haven't heard from anybody in Sheridan yet today, and I think Susan is on the phone from Sheridan. Hey, Susan, John Barrasso, thanks for being part of the town hall meeting.
Well, thanks for calling me, Senator. My question is this: as much as it takes to put together a fighting force of the quality that we have, whose idea was it to send the 101st Airborne to do medical duty in West Africa?
Yeah. Well, it was the president's idea. And Congress hasn't had a chance to vote on that, but that's what exactly is going on. The question is, how do you contain Ebola in Africa fully to protect the United States and the rest of the world? And there's not an answer to that. It does look like this is going to continue to spread. The number of people that have contracted the disease and have died is in the thousands. The concern is by the end of the year, it's going to be much, much larger than that. And it does seem to be spreading faster than it can be contained. I don't know the answer on how to best contain it. What's happening right now, until I think there's actually a vaccine developed, and that's what the researchers are working on, this is going to continue to be a big issue. You can talk about the ways to how to help people get treated, how to make sure that people are fully trained, because this isn't something that really trained for when I was in medical school. It's not something that even the National Institute of Health has listed as one of their priorities over the last years in their budget requests. So it's an area where it's still a lot unknown, but until things are more clearly understood, I think we should be more cautious in the way we respond, which involves, questions of restricting travel, questions of when people come back to the United States, a quarantine period to make sure that they don't have the disease, and that all certainly applies to our soldiers. And it is interesting that the president said, well, I'll send the soldiers over there at a time when you have, Russia on the move, you have ISIS on the move, and the president's pulling people out of Afghanistan. It makes you worry about a collapse there, and the president's focus is on West Africa.
Well, more than that, even it's that they're sending them over there with 4 hours of training whenever the medical community is not even sure what it takes. I mean, nurses are talking about training for themselves, and you're sending combat troops.
Yeah. Well, that's my big worry, and a little earlier in the call I mentioned that I worry that people aren't adequately trained to go over there, not just military, but medical people as well. And when folks say they want to go over, I think you should commit for a period of time so you get full training ahead of time, even of medical personnel. And that from the standpoint of the military personnel, I think the distance that they should be holding, if they're building hospital tents or aid stations, but not necessarily in contact with patients with a disease.
But at least the ones that go over there to West Africa are volunteers, Senator.
Yes, and I think that they need, if they're going to be volunteering, I think they need to be volunteering. This isn't something that you're talking about a weekend or a week there. You need to have full training, full time on the ground, and a commitment if you're going to volunteer to do it, that when you leave there, you have to be committed to security and safety for people back home. So you just can't get off the plane and then return to your normal life immediately. You have to be, I think, treated in a way that makes sure that we in the nation are protected too.
Yes, I agree.
Hey, thanks. Appreciate you being part of the town hall meeting, Susan.
Thank you.
You're sure welcome. Let's continue to work our way around the state, and now we're going to have a call from Wheatland.
Hi, Dr. Barlow.
Hi, Trina. How are you? Thanks for being on the call.
Great, thanks. Hey, regarding Dr. Murthy's nomination as Surgeon General, I heard you on Fox, and you were talking about how it was okay for the Surgeon General in the 60s to be political about cigarettes because it, dealt with one of the three major causes of death in the U.S., heart disease, cancer, and stroke. And actually, gun violence accounts for about twice as many deaths as AIDS, and it's going to surpass automobile accidents as the number one killer of young people by next year if things keep going. So why is it inappropriate for doctors to talk to their patients about gun violence?
Well, I think there's a big difference between what doctors want to talk to their patients about, and doctors choose, and patients get to choose their doctors, versus what the government mandates that a doctor has to ask a patient. And there's a whole list from, say, the American Academy of Pediatrics of recommendations, general recommendations for pediatricians to talk to their patients. Do you have a car seat for your child? Do they seat belt? If they ride a bike, do they have a bike helmet? So there's a long list of things, but that's not a government mandate. That's just saying, if you want to just talk to your patients about issues, these are some things to consider. Smoking is also an issue. We have a constitutional right to own and bear arms, and I don't think the government has a right to come in and say what has to be asked in that relationship between a doctor and a patient. I continue to oppose the government on this, and I continue to oppose this nominee because I think...
But maybe shouldn't a doctor be allowed, maybe, if we can ask, should a child wear a bicycle helmet? Should it be asked to a parent, do you have a gun with a gun safety lock on it in your home?
Well, I mean, I think you had the key word there, which was allowed to ask, not mandated to ask.
Maybe it's mandated. Maybe we should ask if, doctors should ask if the children are wearing bike helmets and if there's a gun lock on their gun in their home. Why would that be so wrong?
Well, I would just say that a doctor and a patient, a doctor gets to work and ask questions that they think are important, and patients get to choose what doctor they go to. At least before Barack Obama enforced the Obama health care law, he said that people could keep their doctor if they wanted to keep their doctor, but now under the law, not necessarily the case. So I think that what we're seeing is more and more government control and less freedom, and that's just part of it. So in terms of what
would like not go to a doctor who asked if they had a gun lock on their gun?
I think people have a right to make those decisions, and that the government shouldn't be the ones saying you have to ask this question, you have to ask that. And
what do you gun locks on guns with kids?
And I would say that this Surgeon General nominee, who's a medical entrepreneur, doesn't really have a long history or much experience, is not really the person to be the Surgeon General of the United States. And the reason that he's not been voted on or confirmed in the United States Senate is because the Democrats don't want to endorse him. The Democrats don't want to endorse him.
Gun locks on guns in homes with small children?
The president has chosen to nominate somebody who is even so extreme in his positions that the Democrats, who support the president 98% of the time, don't want to endorse this nominee. So that's really
on guns.
Really, every senator makes their decision on a nominee for different reasons, but they believe he's not qualified to serve as Surgeon General of the United States, and that's why they haven't had a vote yet. And it's been a year. It's been a year that we've not had a Surgeon General. So those are the issues that we're facing at a time when Ebola is out there, and more people are concerned about the health and health care in America, but yet the president chooses to nominate somebody who can't even get Democrats to vote for him. So thanks so much for being part of the town hall meeting. We're now heading to Cheyenne, and I think Ed is on the phone in Cheyenne. Hi, Ed. John Barrasso. Thanks for being part of the town hall meeting.
Hey, Senator Barrasso. It's good to talk to you.
Thanks.
I just got back from my hunting trip, actually two of them about a week apart, both of them up around Bonnarant. First one was for moose, the second one was for elk. And what I'm noticing is that the Forest Service is locking us out. Now, I'm 73 years old, and for me to get out and hike is not the easiest thing in the world. But they're making it to where we can't even drive an ATV anymore on the roads. They're closing two tracks that I was driving on in the 70s. They look the same today as they did 40 years ago. And yet I don't understand the rationale for closing. As a matter of fact, we had driven into a place where we've been going for a number of years with pickups. We used to drive in part way, park, and then we would hike another half a mile to get to where we were going. Now we can't even drive to where we were used to go with a pickup. You can go with a four-wheeler, or at least temporarily, but we found out that we went in the morning, and one of the two tracks that was open in the morning when we went in had a close sign on it when we came back out later in the afternoon. They're closing the roads behind us even, and they're limiting forest access. It's getting worse and worse, and I'd like to know how we can stop them from restricting us. They claim, I guess, that we're harming the environment, but like I said, if these two tracks are the same now as they were 40 years ago, and we've been driving on them for 40 years, I don't see where we're causing any damage. I'd like to know what can be done to get the Forest Service to reopen our forests.
Yeah. How did you do looking for elk and moose? How'd it go?
I got my moose on opening day. He was a young one, only 2-year-old, not real big, but for me that's a once in a lifetime because it took me 11 years to get the license. I can't apply now and for 5 more years. So at my age, this was it. Elk, we didn't do very well. But it was too warm. We were hunting in shirt sleeves.
Well, I'm glad you got your moose.
Pardon?
I'm glad you got your moose.
Me too. I was thrilled to death, and I got a lot of good meat out of it too. I'm going to really enjoy it.
Good. Well, you do raise the interesting question about public lands because you mentioned the Forest Service, and Wyoming is a multiple-use state. The history of our state has been multiple use of the land, responsible multiple use, the proper balance being struck, and we use the land for recreation, for grazing, for energy exploration, all of the different components of the use of the land, and that's why we've been so successful as a state. So it's concerning to me that what the experience that you've had, and as you said, you've been gone there for decades, and it doesn't look too much different than it did when you were there years and years ago. So I'm going to look into this and see what exactly happened up there. And you said this is right out of Bondurant?
Yeah, it's in the area of the North Fork fishermen, and the Hoback Ranch Estates area. Basically, a couple of miles into the forest from the rim itself. And again, they were already closing them down last year, but they've gotten to the point where it's virtually, you can't hardly go anywhere in there. I mean, even roads that are currently on the current off-road maps that are marked 50-inch and under, they've even been closing those down, which means nothing. They're allowing no motorized vehicles. And again, it's hard for somebody at my age. I mean, I don't mind hiking in, but when I have to add a half a mile on top of another half a mile that already includes hills, and I'm going to do another half mile uphill, it's just getting to be way too much for us. And most of the friends that I hunt with are getting to be up towards my age, and we're all having the same kind of problems. And if we could even get in like in the past, we were responsible. We drove the 2-track. We got into a certain point. We parked it. We didn't go carousing, running all over the lands and everything else. So, again, it's getting very, very bad up in that part of the world.
Hey, Ed, thanks for bringing it to our attention, and I'm glad not just that I'm glad you got your moose tag and you got your moose. Terrific.
Thanks again.
You're sure welcome. Let's head over to Uinta County in Evanston, and I think Sue is on the call now from Evanston. Hi, Sue. John Barrasso. Thanks for being part of the town hall meeting.
Well, hi. I guess I have a couple of things that I'd like to address. I think that the Ebola scare is blown extremely out of proportion. It will affect more medical workers than it will most any other person. They're the ones that take care of the patients, and secondly, along with that is the fact that I don't think, we can't close our borders as it is, and so I don't understand how, keeping people from flying legally coming should have the energy that closing borders that illegal aliens come across doesn't get. It just doesn't make sense to me, because that's where the energy needs to be, is keeping the illegal ones out. The ones who are coming through legally aren't necessarily the ones that we have to worry about. The doctors who have come back, are very aware of their health, and they don't want to cause problems. I don't understand how why it needs to be so blown out of proportion. On the other hand, I have a nephew who's going to school in he wants to be a veterinarian, and he pointed out an article that indicated that for our animals, we can't cross even state borders without a clean bill of health. And so inviting people from other countries to come to the United States, if they need a health certificate to prove that they're okay, there's evidently a horse disease in Africa that horses can't even get in the United States without 60 days of being quarantined. And so I guess, on one hand, I think it's blown out of proportion. On the other hand, it seems like we've placed value on animals where we don't place value on people. That's one of the things I believe.
Well, no, I appreciate your call. And the concern is that since about half of the people that get it die, the worry is that somebody and it can kind of incubate in your system before you become sick yourself. That's the concern, that you're going to pass it on to somebody else during that phase.
That is probably true. But the only person who's died in the United States is the one person who had it, who was not a professional, a medical professional. And so they're taking precautions, but the ones who are surviving that are the medical people who are aware of what's going on.
Yeah, some of the people that are aware of what's going on still getting it, like this doctor who's in New York. And that's the concern, is if you have somebody that's supposedly taking every potential precaution and still has it, and then goes around New York City and then comes down with a disease, I think that raises a level of concern. Your point about the border, I think, is critically important. I made my third trip to the border a little early in August, and this was to go to that area where all these people are coming in from Guatemala, El Salvador, Honduras. You've seen this influx of 50,000, and these tend to be younger people who are sent here, and then they're not sent back. The president's policies have been such that they're bringing them into the United States, teaching them the Pledge of Allegiance, and then trying to put them with other people who are here, and they say, well, they're reunifying families. But when I ask the question, are the folks that they're unifying them with people that are here in the United States legally? Our administration, the president's administration, doesn't check to see if the people that they're turning these kids over to are even in the United States legally. And you do get concerns about what diseases may be coming across with them. They're checked at the border, but that doesn't mean they're harboring additional diseases, and that is a big number there. I think the issue with Ebola is that the fatality rate is so high if someone comes down with a disease.
Right, but the ones who are coming down with the disease are the medical people who are going to seek treatment in the first place. It's an exchange of bodily fluids. It's not, if you have a cut on your finger and you're changing, a bedpan, or you're doing something, it's bodily fluids. It's not communicable with air. And
that's the concern, is that somebody that knows to take all the precautions with bodily fluids is still getting the disease. That's the concern.
Yes, they are, but they're not from it.
The nurses in Texas who were taking care of the man who had come over with the disease, they got.
But
so
those
you're,
people are
you're
not
right.
dying
That's
from it.
the concern, is are people that are going over there to help, are they being fully trained in ways so that they can prevent themselves becoming contaminated? I mean, this is a devastating disease.
If I was taking care of an extremely sick person, I'd be a lot more careful if I knew that it was as easily. I just think the medical people know what they're doing. They're just going to be more careful. I don't think we have to worry so much about those people coming back. They're going to monitor themselves. They're going to be careful. They're not going to be too chummy with people. They may be around New York City, and I guess I just think that part has been blown out of proportion. The other thing that I'm really concerned about is the 47 million people who vote to have their own welfare continued. They're allowed to vote because they're citizens, or at least we assume they are. A lot of those people on welfare are not citizens. I don't understand how we can treat other people better than our own, and how we can allow people, people on. Well, if I had my way, I guess I would not allow people on welfare to vote because it's not fair.
Well, thanks, Sue. I appreciate your opinions and your thoughts, and thanks for being part of the town hall meeting today. We're continuing calling. We have a lot of calls on Ebola, but I have a call about Social Security, and I just wanted to get to this person who's been on the phone waiting a long time about Social Security. I think it's Joanna who's on the phone. Hi, Joanna. John Barrasso. Thanks for being part of the town hall meeting. Joanna, are you still holding on?
I'm still on.
Oh, good. Well,
I'm here.
I know you've been very patient, and maybe you went to do something else, but I knew you wanted to ask about Social Security, and I know that's an important question on the minds of many people. So I wanted to get you, but thanks for hanging on so long.
Okay. Well, the thing is, we keep getting these requests, for money to help the three of you to protect our Social Security. Is our money going where it's supposed to?
I'm not exactly sure what those mailings you are. My mom is 92, and she gets so many mailings, and then I just have her send them all to me, and it's bothersome to me sometimes when it looks like somebody is trying to take advantage of our seniors in a way to make money. And that's
so it has your name and Enzi and Loomis on there.
Well, anybody can write a letter and put anybody else's name in it. So I'd be interested in knowing exactly. I'd be interested in seeing what you got there. Is it an organization or a group, or what's the? Because some of these letters my mom gets, they're pretty sophisticated, Joanna, and some of them look like bills, and she thinks, now, am I supposed to pay this bill?
No.
And so it's very worrisome to me, the sort of things that she gets in the mail, and it is just manipulation, and I think it's just out and out wrong. People can send these sort of things in the mail.
Yeah. Well, this is so our senators can protect our Social Security. And it has your name and Cynthia Lewis and Mike Enzi on it.
Where do they want you to send the money?
I can't remember right now. It's been a while back.
Yeah, okay.
And not very long ago, but I've been getting busy to go south, so I kind of forgot about that, where it did go to.
Well, I'd recommend you keep forgetting about it too, because I worry about. I just worry about this whole general concept of people come up with these things, protect Social Security, and my dad was in World War II in the Battle of the Bulge, and he was one of those. And I'm sure we have people on the phone who are familiar with the gap years and the gap babies with regard to Social Security. My dad's passed now for about 9 years. And my mom still gets things related to that, and he's been gone for 9 years. So it's a real troublesome things that happen out there.
Just ignore that then.
I would if I were you, and we got to really be cautious about the stuff that comes in the mail.
I worried about, and I asked other people because they are getting it too, and so I think we need to know about this.
Yes, well, I appreciate you taking the time to hang on the line this long to ask that important question. So thanks so much.
Okay, bye-bye.
Bye. Let's see, I think we have one other Social Security question. I think Barry has this one because it is an interesting area of concern for so many of us. Barry, John Barrasso, thanks for being part of the town hall meeting. Thanks for hanging on so long.
You bet, John, and you're doing a fine job. Just keep it up. And well, I just hear all this rhetoric about privatizing the Social Security system, and you know, I was just wondering what they're trying to do there.
Yeah, I haven't seen that happen from that standpoint. There's, you know, it's an interesting thing. I was just talking about my mom who's 92. She just had her birthday, and the year she was born, obviously she's on Social Security. My dad was before he passed. Bobby's folks are too. The year she was born, I found this little book about what kind of music people were listening to, who was the president, what kind of cars they drove, and life expectancy. And life expectancy in America for a woman born the year my mom was born was 56. Now it's 81. So we have added 25 years to life expectancy, in just my mom's lifetime. That's the real challenge ahead with Social Security is people are living longer, and you want them to have long, productive, healthy, happy lives. When they put the age of Social Security at 65, people weren't living like they are now. So in terms of it's a tidal wave coming at us, we were talking about this at church yesterday. There's just not as many young workers coming in for the system. So you worry about the funding for the future for Social Security, and you talk to most young people, they don't think it's going to be there for them. So those are the concerns, and Mike Enzi and Cynthia Lummis and I hear about it all the time as we travel around the state. But I haven't seen any legislative language right now in terms of trying to privatize it. So I hope that answers your question.
Well, it does, John. And then another thing I heard that the president was, after the election, he is going to grant amnesty to 14 million people. Is that correct? I've heard
similar rumors. There's things like that on the internet. The president earlier this year said he was going to do things with executive action, and we don't know what he's going to do. Don't know what he's going to actually do. You would think that the election results would have an impact. If the American people say, hey, we're tired of Harry Reid and the Democrats being in the majority of the Senate, and they add more Republicans in the House, you would hope that the President of the United States would take a lesson from that and realize that it's time to work with people to solve the problems of America, one of which is illegal immigration, the number of people that are here illegally, and rather than say, something disrespectful to the voters and ignoring the message being sent by the voting public. But I wouldn't put anything past him in terms of what he may choose to do with executive actions if, in fact, the Republicans are able to take over the Senate. So I appreciate you.
John.
Yeah.
Just one more thought there. It's just a shame that politicians that they don't do what's right for the country instead of what's right to get themselves reelected, and it's sad. It breaks my heart.
Well, I appreciate you being patient to be on the phone call today, Barry. You talk about what's going to happen after the election. Let me ask folks who are still on the line what we ought to do, what the primary focus ought to be after the elections. I'm just going to give four different things, and I'll tell you, then we'll push buttons on the phone if you wouldn't mind. If you think the focus primarily ought to be on jobs in the economy, push 1. If you think it ought to be focused on reducing the debt, press 2. If you think it ought to be focused on health care, press 3. And if you think it ought to be on strengthening America's defense and military, press 4. So those are the choices. Jobs in the economy is number 1. The spending and the debt is 2. 3 is health care. And 4 is getting the stronger defense. So those are the options and the questions. And if there are ways that we can be helpful to you, please let us know. I'm in the Casper office today, down next to the post office in the Federal Building. We have offices in Cheyenne, Riverton, Rock Springs, Sheridan, and then the office in D.C. If you're going to be in D.C., we'd love to see you. There's a toll-free number that anybody can call anytime, 866-235-9553. You can go to my website, www.barrasso.senate.gov. If you have a child or grandchild who's interested in a military academy, let us know. We want to help them do that. We'll have a time in early December where we invite all of the people that are applying to come. It's December 6th. To come to visit with from my office, as well as Cynthia Lummis's and Mike Enzies, to talk about the issues and to try to help those young people. We want to help them get the strongest application and give them opportunities. We've just had a military deployment in the last couple of days, so the number of members of our Air Force National Guard have been sent overseas with all of the turmoil that's happening now in the Middle East. And with ISIS and with what Putin's been doing with the Ukraine, we've just sent about 101 of our brave men and women overseas in that. So please keep them in your thoughts and in your prayers. But I appreciate you taking the time to be part of the telephone town hall meeting today. It's Monday, the 27th of October. Election Day is next Tuesday, and please don't forget to vote for whoever it is that you believe will best represent you and your views. Anyway, thanks so much for being part of the telephone town hall meeting, and have a wonderful Wyoming day.